So, hi Emma, lovely
Hello.
to come online and see you today.
Thank you.
So, Emma, I've known for quite a while now, but your um, career nowadays has taken a direction and new direction, and you're now a canine therapist.
That's right. Yep.
And your name of your business is,
ELC Animal Therapy.
so people can Google that or find you on Facebook
Yeah.
or
Website, Facebook, Instagram, Twitter, LinkedIn, you name it.
yeah,
I'm there.
because you're young and you know how to do all that stuff.
I
Like me.
try. I try.
So Emma, it's really nice of you to come online because I felt like
Thank you.
touch is a really important part of animal behaviour training, as well as physical and emotional well-being for
Absolutely.
humans as well as dogs. To be honest, I mean,
Yeah.
we get so much benefit from touching them, which I'm sure you can go into for me a little bit more.
Yeah.
So, do you want to say a little bit of what you do and what you think is helpful about it?
Sure. Okay. I do massage, physiotherapy, and rehabilitation now. But obviously, the main thing for me with this stance that we're taking today is working with owners to identify problems, not just physical problems, but mental problems as well with your animal, and how it's all interlinked. I'm sure we'll go on to that with behaviour later. But the owner side of things, it's more trying to raise awareness now. And I treat horses also, and horse owners seem to have got to that stage where, you know, they can identify a lot more. Maybe because, you know, a lot of people are, in inverted commas, exercising them every day, whereas people don't necessarily deem dog walking and things like that as exercising their animals as sort of the animal's job. Obviously, more so than ever now, with the lockdown, dogs are being walked and exercised a hell of a lot more. And it's just basically raising awareness with owners that the dogs are just like us. You know, if they have a slip or a slide on a step or on the laminate flooring or out walking, they feel the aches and pains that we would do if we had the slip, or, you know, if we fall down a drain or our ankle goes down a step. They are the same as us.
Yeah, and I think with dog walking, I think that was a very interesting point you just made there, which was about how I think we see walking a dog as exercise in the sense of it's always enjoyable for the dog, which I'm sure hopefully it is. But you don't think, but if it was a horse, you might think, I think it'd be more easy to think of a horse as getting overworked or over-exercised.
Yes,
I don't
absolutely.
know if people think of dogs in that same light.
And there's actually a few videos going around today on social media of dogs, you know, just sitting down mid-walk or refusing to, or just laying down in the park, and the owner's not being able to get them up. Now, if a horse did that, or a human did that, we would identify that as a problem. But they think, you know, people are not identifying that actually there may be something wrong, emotionally or physically, with the dog. And it's just, you know, lack of understanding and naivety more than anything. We're not blaming dog owners for not noticing things and whatever else. We're purely here to educate people and help.
Yeah, I think that's so right. It is about education, because I think, you know, I've certainly over the years had owners whose dogs have dislocated something or have gone lame, or, you know, the vets put them on painkillers or something, which, yeah, sure, alleviates the problem for a bit. But whereas with a human or a horse, you would get a physio in a blink of an eye. It's not as common in dogs. It's getting more so because people are getting more awareness.
Definitely more so, yeah.
But I certainly in the agility world, I know that people use physios a lot.
Yeah.
But I'm not sure it's as common with pet owners yet. And it's certainly something I want to encourage people to think about a little bit more.
Yes, most definitely. And also with things like agility and your fly ball, although yes, physically day to day they look like they're under a lot more pressure. Those are the owners that have the physios, the massage, the hydros. They are aware that those dogs are working hard, but also their exercise is very much regimented and very much planned. So actually they are probably less likely to pick up day-to-day injuries like the standard domestic dog is, because they are, you know, they're in a fitness regime, they are fed accordingly and the right things, but they're also monitored every single day. Whereas obviously domestic dogs just generally do not have that at home.
And I think I'd certainly like to mention a client I had many years ago, which I feel I can mention because it was so long ago, really. But she was such a keen walker that she had golden retrievers who are a big breed. She was such an enthusiastic walker. She used to walk her goldens 2, 3, 4 hours a day. She didn't have one that didn't have to have operations on their hips and shoulders and knee joints, because the dogs' bodies were just, you know, obviously she was obviously made of sterner stuff than her dogs, but she just wore them out. I don't think people are aware that that's possible even with a dog, do you?
No, mentally and physically again. And with, especially with that type of breed, the retriever breed and things like, you know, your hounds and things like that, you know, they are bred to work and whatever else. So they don't really know when to say no. Whereas there's certain breeds that can say no a lot easier and a lot quicker. So yes, like you say, also with the bigger breeds, you know, they are more prone to joint issues because of their size, and diet and exercise and everything else has a huge part to play in all of that.
So where would you come in terms of giving owners advice, you know, in terms of maybe checking their dog's bodies over? I don't know which is the best place to start today.
Of course.
Have you thought about that?
So if a dog owner approached me and asked me that question, the first things first is, you know, ultimately 9 out of 10 dog owners will touch their dog in some form during the day, whether it's to put a lead on to go for a walk, or to groom their coat, or just for a cuddle, or that even, I'm sure kids, you know, cuddle their dogs and things. Take an opportunity every day, whether it be, you know, before you plan to walk them or whatever else, and just scan the dog, which is purely just running your hands over them very lightly, literally, you know, fingertip touch, and just feel across their body. Now, this allows you to feel what's normal, what's not, if there's any heat or swelling in places that there wouldn't normally be, that their weight is okay, especially with long-haired dogs. You find, I find when I treat a lot of things like cockapoos and things like that, actually owners can actually be quite ignorant to the fact that they can be under-muscled and underweight, but the coat obviously hides that. So yeah, just scanning the dog, even every other day or 2 or 3 times a week is fine, depending obviously on the dog and its behaviour and what it can tolerate. And just check what's normal and what isn't. Write it down if you know you find that would be easier, or if you think that there is a slight change, then make notes and then think, okay, after a week, okay, that there seems to be you know, a bit of swelling in the dog's forearm or across his back, or there's a small lump appeared, especially now in lockdown with vets being closed. You know, make a note of it and make a start that way. And then again, just when you're walking, just keep an eye on the dog. Watch it actually walk and run. When you're just observe it rather than just, you know, throwing the ball back and forth or you know, talking to your partner. Just have a little look and see, okay, is his head nodding? Is he or she, you know, walking regularly? Things like that. You know, just general day-to-day checks
When you say nodding them, could you explain that to a lay person? I get what you mean by that, but
Sure.
not
Okay, so
everybody would.
there's two forms of nodding. Same with horses. It can either be nodding in the sense of, so when the forelimb, front leg in easier terms, moves forward, they can either brace themselves and throw their head up, or nod and direct their head down. That indicates lameness, both front and back, not just front. And that can indicate that there is pain somewhere else, and they're trying to basically balance and compensate within their body. That's quite a large indication to leg lameness normally, but can also be back.
Okay, and also then you said about their stride. I think something around that. What would people look for in terms of problem in striding?
Sure. Okay. So obviously, each dog has a very different, I would call it gait, but to owners it would be stride. So it's just basically the how they walk, how long their walking stride length is. If you notice that, okay, the dog isn't stepping with his hind legs as he should, or feel, so it looks like he's slightly shuffling, or even with one leg, just not bringing it forward, or not wanting to draw it back, and just trying to keep it straight and things like that. Just keep an eye on what, again, obviously what is normal and for the dog and what is not. But obviously there's people like me out there that if people don't know the normal, or are concerned that they're not seeing the normal, then at the moment especially, just send a video to your therapist or your physio, and just get advice.
Good idea. That's a brilliant idea. So people could send you a clip or a little video of their dog moving, and if they wanted reassurance that their movement was okay, or maybe for you to just see it when it was good, so you'd know if it was changed.
Absolutely. I recommend to all of my clients and people that I help to take regular videos, even if it is just someone walking your dog up and down on a pavement or on the grass. Especially if you are concerned, then regular videos allows you to obviously then make comparisons and allow professionals to see if there's been deterioration or improvement or change.
Okay, yeah, brilliant. So then in terms of, if you wanted to, because today our title of our talk was to do with massage, are there some moves or touches that you could recommend to people that would be safe to practice at home?
Yes, absolutely. I recommend it to everyone for numerous reasons, and I'll probably defer this slightly to you in a moment. But relaxation is a huge one, and dogs suffer with anxiety just as much as we do. So the main movement that I ask owners to partake, which not only helps them, not only helps the dog, helps the bond, also helps when therapists or vets need to get involved. The dog does not then anticipate the touch or think that, because a lot of dogs wouldn't have that contact, and then all of a sudden a therapist or a vet gets involved and pulls them around. It's called effleurage, and it's literally just simple movement. Effleurage.
Effleurage, okay.
Yeah. It's a French word, and basically it is literally just strokes with your palm, and just simple strokes. Go with the hair. Obviously don't go against it, because that's going to be irritating the tissue underneath. Numerous benefits. One, again, relaxes the dog. Two, promotes circulation. Big one in dogs. The better the circulation, the more chance the body has of healing and repairing itself naturally. Just softens the muscle and the fascia under the skin, and just is a real good relaxant for the dog in particular.
And are there any particular areas of the body that you'd focus that on?
Yeah, the main beefy areas of the dog, so where the big muscle groups are. So along the back, depending obviously on the dog and its conformation or body type. So first of all, yes, along the back, and then down the shoulder and down the back where the hamstrings are on the back leg. Some dogs tolerate tummy, some do not. So obviously very much play that by ear and be safe with your animal. But the main muscle groups with the dogs are the tops of their legs and their back.
And how could you, is there a way you could describe the type of pressure to use? Because I think that's quite easy to miss. The different people will either do it too light or they'll do it too heavy. Have you got a stock in trade answer for that?
Again, it's very much sort of individual to the dog. Obviously, a dog like your moose, a tiny little one, you're definitely only going to be using fingertip pressure. If you've got a Great Dane, or for me, I've got a German Spitz. Now, although he's little, I do have 6 inches of hair to get through. So, you know, a palm pressure is enough. But again, keep it consistent and try not to take your hands off the dog. So try not to do one stroke and then lift. Try and make it continuous with both both
that's
hands.
A good tip. Real good tip. Yeah, that's nice.
Because it's to dogs, and I'm sure you'll confirm, if you keep taking off, you're creating an energy, and also they're anticipating your next move. Whereas if you've just got constant strokes and your hands are not leaving their body, they're able to relax and able to accept it. And
speed? What sort of pace or beat?
Very slow. Okay. As slow as you can possibly go, really.
Right.
Yeah. If a lot of questions I get is, well, my dog won't sit still or move around. I recommend being on the floor with the dog at their level. Try not to bring them up if you can help it. And you know, just start it with a few strokes. Have them on lead to begin with, especially if you're worried about your dog's behaviour with it, because you need to be safe. And just a few motions, you know, every day, and then just slowly build it up until and they will relax and they will settle. It's the same with all of your training, as I'm sure you can go on to say. You know, it takes a while, and don't overdo it at the beginning. Just a few strokes and then relax and then just build it up slowly.
Yeah, that sounds good. So you sort of build up their tolerance for it.
Yeah, absolutely. And then they understand that it's a positive behaviour and it's a positive reinforcement.
And would there be anything that you'd advise people to be looking for as they're touching their dog like that might constitute a problem? You know, so I know we've got the looking at them and seeing if there's a problem, but maybe we haven't spotted anything, but we're doing that. Would there be something we might feel that might be not quite right that would give us a clue?
Yeah, sure, absolutely. For starters, most, as we are, none of us are 100% symmetrical. However, with dogs and horses, they should be relatively symmetrical in their muscle mass. So if you're stroking one side and you're feeling what you're feeling, and then you feel on the other side, and either it's very much the muscle is thicker, or they feel fatter on that side, or they aren't as tolerant to you on one side as they are the other, that all signifies that there could be muscle tension, muscle wastage, bruising. Obviously, you know, they trip and fall and knock themselves, especially dogs, to be honest, they run into everything. You know, that they suffer from bruising and things like that too. So yeah, absolutely, try to compare each muscle to the other side if you can, and identify if there's differences. Obviously, if the dog is not happy with a certain area, that does signify, you know, that there probably is an element of pain there. But don't panic if that's the case. Try and continue if they will tolerate it for a small while, because obviously the more blood flow we can get to the area, the better, because the body will then initiate its own healing process. It will identify that there's a problem there, and then in turn hopefully start repairing itself.
So I'm thinking already that you've given a tremendous amount of hints and tips and ideas and things for people to think about. So I'm wondering maybe if you've got some sort of handout or fact sheet or information that you could send out to people.
Yeah, absolutely. So I have a sheet that I give all of my clients and anyone that contacts me, to be fair, I don't have to have seen you before, with your standard massage techniques and some small pictures and things like that. I'm in the process also of making some video tutorials, especially now that I can't just turn up at people's houses and facilities. So, you know, if anyone is concerned about doing it and not trusting their own feel and whatever else, not a problem. You know, contact me, tell me. And if the handouts, you know, aren't enough, then I can do a video live, or I can send you over some of the tutorials. That's not a problem.
So maybe when we put this video up, when people are watching this now online, we could have a link beneath it that would take them to either to your page or to a link of a tutorial or something, or a fact sheet or something.
Yes, absolutely.
Or maybe even put something written in the comments under the video, and then they could contact you for more information. Or
of course, no problem at all.
And Emma, you are on the Dog Karma closed group as well, I think.
I am, yes.
And so people can, if they don't want to go public on Facebook, they can always contact you via that.
Of course, I can. I'll also, I'll put my contact details on there. That's no problem. I will also highlight that although lockdown is obviously very much in place, if your dog needs urgent physio or massage, I can come out with social distancing. All I have to do is basically get a letter from your vet to say that your dog needs treatment, and that will suffice. So don't panic if you then worry that your dog is in pain and you can't get to a vet or a physio. We vets and physios can very much still work with you within reason. Yeah,
and my guess is you take all the necessary procedures, I'm sure. I can only imagine that, because I know how particular you are.
Yes, and that hasn't changed. Lockdown's just emphasised.
OCD gone crazy.
Yeah.
So I wonder if there's anything else. I feel like you've answered so much. I can't actually think of another question right now, but I wonder if there's something you wanted to say. Oh, I know about your later in the year thing, but I wonder if there's anything else you wanted to add to the massage stuff.
Yeah, a couple of things. When not to massage.
Oh, good. Yeah. Good one.
If your dog is being treated actively with cancer and cancer treatment, do not massage them, because the last thing you need to do is increase circulation to the areas that you're currently targeting with treatment, because that can have a negative effect. Obviously, if with any treatment that I partake, I have to get vet consent. So if you had any concerns or you wanted to do it with your dog, if it was on end of life care, or you feel that actually with the treatment it would benefit, no problem, message me and I will have a discussion with your vet to check. Also, if they have any open wounds, do not massage the areas. You will increase blood flow to that area and risk more blood loss. Do not do that.
Well done. Good one. Well done. Good safety stuff. Yeah. And then so finally, I believe you've got some courses planned for when we come out of lockdown.
Yes.
Our exit strategy.
They weren't meant to happen later in the year. They were meant to have started now. But I've been working behind the scenes and being able to now provide canine massage for owners courses. So they will be covering a full canine massage that owners can do. Obviously, it won't be to the extent of a therapist. but also stretching techniques, and very basic sort of first aid if you see that your dog is, you know, injured when you're scanning the dog or massaging the dog. Just things like heat therapy, ice therapy, and things like that owners can obviously all do before they call a therapist or a vet or all of the above. I will be setting up a shorter online course for people that want to do it in the meantime. That will be live hopefully in a couple of weeks. So obviously that will be open to everyone. But I will put the dates of the Essex dates in particular in the comments.
Yeah, fabulous, wonderful. Well, that's amazing and really, really helpful, Emma, which I knew it would be. And hopefully we'll, I think there's a couple of other things we wanted to look at. Oh, I know you were going to put together something and put up live on or on upload at some point about how to use Zoom for anyone who's unsure of it.
I will. Yeah,
which
absolutely.
your clients as well as mine will be able to use, and anyone else really who would find it useful. I'm sure you won't put any limits on that anyway.
Yeah,
of course. No, public use, no, so that'd be great. Yeah, that'd be brilliant.
Yeah, I have one question.
Yeah.
Obviously, with this, do you have any pointers with regards to if people experience behavioural issues whilst trying to do this?
Yeah, good point. I think I think I'd almost backtrack, because if you can't touch the dog generally without it play biting or biting, I think that's got to be addressed before you try and do more.
Absolutely.
Obviously, if the dog was injured, then you'd have to work around it a bit more, and I'm sure there's things you could do, you know, even if it was sedation or something, if it really needed treatment. But for me, it would be about working with the dog's tolerance of touch. And one of the best ways through that really is food.
Yeah.
Is just, you know, do a bit, reward, do a bit, reward. And just make sure, I think, for me, one of the mistakes I see people making, and I think you might agree with this, is it's very easy for people to use fingers. Yeah. And when you put your fingers in, it's really ticklish and uncomfortable for the dogs. And so it's really making sure people keep their hands flat.
Yes, absolutely.
So easy to dig, don't you think? Yeah.
Yeah, absolutely.
Yeah, which you said, but I think it is worth saying, don't do that. Or that brush the hair the wrong way thing will make them unhappy as well.
Yeah, and also that negatively, well, not negatively, but it stimulates the tissue underneath. So as a therapist, obviously, I will aggravate and stimulate the tissue as and when it's needed. But when you're pushing the hair, especially long-haired dogs and dogs with a curly coat in particular, pushing that the wrong way is actually quite aggravating on the tissue underneath, not just the hair, but the fascia and the muscle underneath. It's all connected.
That's all quite negative for the dog.
Yeah, and you can get quite a reaction, even though, you know, you probably think that you've only just touched the hair. It's the hair, you know, the hair follicle is within the skin that's connected to the fascia, which is also connected to your muscle tissue.
That's really, really interesting, because I know for a fact that it bothers them, but it's quite interesting to understand the underlying cause behind that as well. Really interesting. Yeah, brilliant. Lovely. Well, thanks, Em. I'm sure this is the first of many of our little live chats, but I'm really enjoying making this little series. I think it's great fun, and the feedback so far on the one we did last week was really positive, so I'm sure this will be just as good.
I'm obviously more than happy if there are a lot of questions that come with this.
Yes.
Obviously, if they wanted, we could do a question and answer session.
Completely,
together. That I've got no problem, because I always find that a lot of people come away with quite a lot of questions, and rightly so. And no I might question is too silly
afterwards as well. Yeah, no, I might because I think you've given so much information. It's almost like you've answered a lot of my questions as we've gone. But
Yeah.
my guess is I'll go away and then there's sort of another
Think of
layer
some
of
more
questions. Yeah, absolutely. I think people watching might find that too.
Yeah, of
That's
course.
brilliant.
And also with any dogs that have any, physical issues already that you're aware of, your osteoarthritis, cruciate recovery, things like that. Obviously, just get in touch because I can provide you with some massage plans specific to that illness. Don't feel that you can't give your dog more, because you can.
Fabulous. That's lovely. Thank you so much, Em.
You are very welcome.
That was just
Anytime.
wonderful. And look forward to speaking to you again very soon. I'm going to stop the recording now.
Okay. Bye.
Do you want to stop my